You've got questions? Well, we have the man to answer those questions, Jeffrey Levine from Buckingham. Jeffrey, welcome back to another episode of Ask the Hammer.
Good to be with you, sir.
Oh, good to be with you because I think you have the answer to this question from a reader. It goes like this. I plan on working till age 70 at a large corporation. I only enrolled in Part A at age 65 in March. I am covered under my employer's health plan. I do not have Medicare Part B. I have a FSA. Do I really need to give it up?
So first thing is the answer is no. You don't have to give up your FSA. That is a flexible spending account. Now, this is an area of confusion for a lot of people as they turn 65, as they begin to enroll in Medicare. And it's particularly complicated for those who work with large employers because the rule for those individuals is different than the rule in general. The rule in general says beginning at 65, you typically need to enroll in Medicare. That's both Part A, and you probably want to be enrolled in Part B as well, and oftentimes Part D, a prescription drug plan. But a large employer, that is those with more than 20 employees, they are, if you work for one of those employers, you're actually able to stay on their healthcare plan and continue to avoid enrolling in Medicare without any penalties down the road if you then later apply. So oftentimes that's what people do. However, Medicare Part A is basically free for most people. And so at 65, a lot of times it pays to just enroll in Part A. Part B typically does come with a cost. And so that can be more of a decision, but enrolling in Part A is typically free. Now, it doesn't mean it doesn't have any consequences. One of those consequences is that if you enroll in Medicare, whether that be A or B or whatever, you are no longer allowed to make HSA contributions. Now, that same rule, however, does not apply to flexible spending account contributions. And this question specifically asked about that account, flexible spending accounts. So no impact there. The only other thing I'd mention here, Bob, is, the question said, do I need to give it up? Right? In other words, it almost makes it sound like if I have it, let's just pretend the question was asking about an HSA and not an FSA. Well, even there, the answer would be no. You don't have to give up your HSA. You just can't contribute anymore to it. But you can always use the funds that are there, plus whatever future growth occurs, to pay your bills, your medical expenses, tax and penalty free. So you don't have to give up contributions to an FSA, and you don't have to give up either an FSA or an HSA, the accumulated funds already when you enroll in Medicare. The big thing is no more HSA contributions.
Yeah. So with respect to FSAs, one wrinkle is that it's often a use it or lose it account.
It is, yes, that's right. So FSAs in general go by use it or lose it rules. However, an employer can offer one of two sort of methods of slightly reducing the use it or lose it nature of the account. There's a small amount that you can roll over from one year to the next if your employer allows you to do so. It's about $500. It's inflated per year based on the IRS's cost of living adjustments. But there's another one, and that is the opportunity to potentially use, let's say, 2023 funds during the first 2.5 months of 2024. That would allow you to effectively roll over, if you will, an unlimited amount, but you have to use it within those 2.5 months. And again, these two different options, employers can, but don't have to use either one of them. So it's always important to check your particular plan. What does your employer use, if any, of these flexible options?
Right. And then last question is, in terms of how you can use the money in the FSA, you can use it to pay for co-pays, deductibles, qualified medical expenses?
Yeah, that's typically the case. You generally have flexibility there. There are some exceptions. For instance, if you have, let's say, an HSA, then your FSA becomes what's known as a limited purpose FSA. So there's fewer number of things that it can, to pay for. Generally, we're going to be limited to things like vision expenses or dental expenses. But if it's a true general purpose healthcare FSA that doesn't have those restrictions, yes, a lot more viability there for different expenses. You can also go buy, certain over-the-counter medications with it. You could buy, let's call it, for certain first aid products. Now, you do have to be careful, though. You don't want to go and buy, let's say, $3,000 worth of gauze. That's probably not going to pass muster with your FSA sponsor. They're going to deny that because there's sort of a rule against stockpiling, if you will, buying more than you can actually use during a reasonable period of time. It's not a hard and fast definition of what that is, but obviously employers want to make sure that the qualified nature of their plan stays intact. And that means making sure that these are qualified medical expenses. And again, it's not just used to stockpile for the future.
All right. Well, I want to stockpile more questions, Jeffrey.
I would love that. I would love to see our inbox inundated in that regard. So if you've got a question, let Bob and I know. Give us a shout at askthehammer@buckinghamgroup.com. Again, that's askthehammer@buckinghamgroup.com. And Bob and I look forward to tackling your questions real soon.